Hi friends, I'm Dr. Anushree Muralidharan from Divineveda. Today's topic is how to recognize GERD in your children. In my last video, I explained what GERD exactly is and how to treat it naturally. Link of that video is given in the subscription box below. But GERD isn't just an adult's problem. It affects kids also, even babies. In this video, I will be explaining the causes of GERD in children and how to recognize it easily. Please watch this video till the end to know why your child spit up or brings up food even after feeding or during feeding, and why there is frequent vomiting or recurrent cough after feeding. About 10% of the babies under 1 year of age suffer GERD. Most of the infants outgrow this condition by 1 year of age. GERD is more serious than GER or simply gastroesophageal reflux. In some cases, it is normal and harmless, but in some cases, it can become harmful too. The usually noticed symptoms in adults are sore regurgitation, heartburn, bitter taste in mouth, sore throat, lump-like feeling in throat, difficulty to swallow, hoarseness of voice, recurrent cough, frequent vomiting, asthmatic symptoms, dental erosion, and bad breath. In case of babies, they are unable to express what they go through. Especially in case of infants, they are unable to express verbally the heartburn, the chest pain, bitter taste in mouth, and difficulty to swallow. They may be going through all the symptoms, but their inability to express these symptoms verbally should not confuse us. So this is for every parents with babies. If you carefully notice certain signs and changes in the behavior of your child, you can figure out whether your child is suffering from GERD or not. Symptoms to be noted in infants: spitting up food, recurrent cough, wet burps or wet hiccups, frequent vomiting, irritability, refusal to food, difficulty to sleep, slow weight gain, choking during feeding, breathing difficulty, bad breath, and wearing away of teeth. Normally, children may show some of the signs, but when this becomes very frequent, then it should be understood that there is some underlying cause, and that may be GERD. Once if you get a suspicion, don't wait. Immediately seek medical attention and go for a precise diagnosis. The diagnosis is by reviewing the symptoms and the medical history of the patient, as well as by the advanced techniques like esophageal mobility test, barium swallow radiography, gastric emptying study, esophageal pH monitoring or acid testing. All of this help us to get a precise diagnosis. Certain factors that contribute to GERD are obesity in children, overeating, eating spicy and fried foods, chocolates, carbonated drinks, and tomato products, and due to some medications. They may genetically inherit it from parents too. Here are some tips to better manage GERD in your children. After feeding, hold your baby in upright position for about 30 minutes. If bottle feeding, keep the nipple filled with milk so that baby won't swallow too much air. While sleeping, elevate their head a few inches with a small pillow. For elderly children, watch the food intake of your child. Don't let their weight go so high. Rather than giving too much food at a time. Small portion of food should be given multiple times. Avoid excess intake of tomato products, chocolates, and peppermint. It is important to talk to your doctor if there is no reduction in the symptoms even after these things are taken care of. Please do subscribe to our channel. Daily we will be posting videos on Ayurveda, diet and lifestyle correction. And here we will be discussing how to get cured of various diseases that are affecting mankind through Ayurveda, diet and yoga. We are on a mission to make aware the greatness of Ayurveda through YouTube and other social media platforms. I request all of you to share this video with your friends and relatives. And please don't forget to comment down which health issue you want us to discuss. Thank you for listening. This is Dr. Anushree signing off.